Thank you very much, Dr. Njoroge, for that wonderful welcome. Hello, everyone. As mentioned, my name is Samuel Mbugo, or Samuel Mugai Mbugo. I'm a nurse by training and also a public health specialist. So I am honored to be here. I'm honored to be able to take you through this session on an introductory phase of first aid. And the principles involved in first aid. Please feel welcome. I'll divide the session into two. You're welcome to ask any questions during the first session. So without wasting much time, I'll quickly delve into it. We'll first begin by defining two quick terms, two very important terms when we think about first aid. And also just to build up on what Dr. Mary Mugwe has well covered on school health and other facets of social determinants of health. When we think about the health of a person, a student, even our own health, we're usually plagued by situations that present life-threatening scenarios. So a medical emergency in that case would be a situation that presents with or presents one person, an individual, with a life-threatening situation if not treated immediately or managed with quick precision. While first aid, on the other hand, is the immediate, the temporary care that is administered or given to a person in distress. This person in a life-threatening situation before regular or specialized medical care can be availed. Please note, very importantly, that first aid is not restricted to the physical, but also involves psychological support as well. And this, we shall see this shortly, why the psychological support comes in. But why is it? Why is first aid important in a life-threatening situation? It can help to save a life. If you think about anything that involves resuscitation or helps to extend a person's life before a trained health provider can get access to the person. So first aid, and it's important that as we go through it, we think about it in simplicity and then build up on the knowledge we already have. Just to get an all-rounded view of what we would do in a medical emergency. So important here to save a life, to reduce pain, very important, because pain is one of the most important human responses to a life-threatening situation that might involve injury. Next is to prevent further injury, further deterioration. For example, if you get to the site or the scene of a medical emergency, your quick response will ensure that a person does not get, for example, if they have a simple fracture, that it doesn't complicate and might even result in an amputation in a worst case scenario. So preventing further injury, very important. It also reduces the risk of permanent disability. Because the mitigatory measures we take early are very critical towards ensuring that disability and complications of an emergency are prevented. It also increases the chances of early recovery for a patient or a client or a student for this matter, because early measures taken early are very important in going back to what we said earlier, prevention of further injury, prevention of complications. This increases the chances of a person's quick recovery, hastened recovery. Immediate action is very important, hence, when we think about quick recovery. For example, early access is the first step in the chain of survival, and quick action is critical towards saving lives. What you do initially is very important and does not mean, for example, it does not mean the following: panicking in case of a situation. It's important to be quick, calm. Very important to be controlled and thoughtful. Okay? These are very important contributions when you think about immediate action. Now let's think about the chain of survival, which involves three critical circles. One is the early access to a patient. Early adds on to the value that we get from immediate action. All right. Then comes early CPR or cardiopulmonary resuscitation. Very important, and this can further be broken down into early cardiopulmonary resuscitation and defibrillation as well, and we shall see that in this next slide. Early advanced care is also very important. This involves the healthcare provider and ensuring that the child gets to a trained healthcare provider early. So please note that the first two links in this chain of survival, that is early access, early CPR, and early defibrillation, are very critical when we think of ourselves as first aid responders. So the chain of survival, as I had said, can be broken down into these four circles. The first circle, which is early recognition and the ability to call for help. This is important because it prevents cardiac arrest. Very important because cardiac arrest and also cardiopulmonary resuscitation, for that matter, is very critical here as in terms of first aid. Then early CPR, early cardiopulmonary resuscitation. This is vital because it helps us to buy time by restarting the heart, for example, ensuring that there is adequate respiration and ventilation to our patients. And also, it helps us to ensure that the patient reaches a healthcare provider early in time. Then we've got early defibrillation, which involves administration of an electrical impulse to the heart. And this is if a patient's heart has stopped and you need to restart it. And then we've got post-resuscitation care. This is administered by healthcare providers to restore the quality of life. All right. Now let's look at universal precautions that we need to think about in first aid. These are actions that are taken to prevent the spread of disease by treating all blood as if it were contaminated. And it's not just blood for this matter. Think about any fluids, any secretions that are from our clients, from a patient, from a student, treating them as if they were contaminated. Now, we've learned this very well during this COVID pandemic. What actions do we take to prevent the spread of a particular disease? Could be bloodborne, could be airborne, by ensuring that we follow the following precautions. One is wear protective gloves when treating a patient, if available. If not, take necessary measures to ensure that your hands are adequately cleaned before and after administering first aid to a patient. Use a face mask or a face shield when giving first aid in case of ventilation or breathing emergencies. Again, very important. A shield is something that can be placed over a patient's mouth while giving mouth-to-mouth breaths or ventilations. Covering any open wounds on your body with sterile dressings, even on those of the child or the injured person, is very important. This is critical because it helps prevent onset of sepsis and infection. Avoid touching any objects that had contact with the victim's blood as well. Important because this will help us to prevent, again, transmission of any infection. Always wash your hands thoroughly before and after first aid, for this matter, if, for example, you do not have protective gloves. So those are universal precautions we think about when you think about infection prevention and control. Let's think about how do we recognize signs of an emergency. This involves using our 5 basic senses of hearing, sight or vision, smell or olfaction, and this will alert you to most emergencies. For example, listen if you hear people calling out. This will alert you to an emergency situation. A strong smell that might elicit or come from an infected wound, for example, might even cause stinging of the eyes, might cause a cough, or make breathing difficult. These are signs of a toxic gas release, for example. So use of your senses is very important in recognition of an emergency. Making a decision to take action involves evaluation of a situation and deciding on what action to take or what is needed. So your first responsibility in any life-threatening situation is your own safety. Please always note and underline that somewhere within your thought process. Your own safety is critical and is your basic responsibility. Please ensure that you never put your life in danger with the thought of helping someone else, because if your life is in danger, their life is also in danger. They're in the same situation you're in, and none of you can help the other. So don't put your life in danger, even if it involves an emotional response to someone we deeply care about. For example, our students. Do not put your life in danger with the thought that you might be helping them, because two people in the same pool means you're all wet, so no one can help the other. Who needs first aid? What are the likely scenarios that would require administration of first aid? Involve cardiac and respiratory arrest. Someone has stopped breathing, or someone's heart has stopped beating. An electrical shock, which again would cause a cardiac arrest. Someone with a wound, could be a penetrating wound, it could be a simple abrasion. All these are different types of wounds. In case of bleeding or hemorrhage, okay, someone has gotten involved in a life-threatening situation that involves fire, burns, and burns can be different types of burns. It could be an electrical burn, could be it could be a thermal burn, different types of burns. Fractures and traumatic injuries as well. Poisoning, drowning, very common, especially in young people, because they are very prone to try new things. Someone would want to, swim through to the deep end of a swimming pool, and they don't exactly know how to swim properly. And even snake bites. Okay, people who come from rural areas or places where there's heavy vegetation, snake bites are quite common. So what are the aims of first aid? Again, preservation of life, okay, because you aim to save a life. Prevent deterioration of injury or illness. Very important. Complications, this is where we come in with prevention of complications. Promotion of quick recovery, and to protect an unconscious patient. This is important because an unconscious patient is not able to respond to stimuli. They're not able to tell you that they're in pain. So their protection in a first aid or in a life-threatening situation is important. Now, how do we preserve life? Ladies and gentlemen, it involves checking, clearing, and maintaining the airway to ensure that there's adequate oxygenation and ventilation into the lungs. It involves checking and clearing as well as maintaining breathing. This involves, for example, if we need to perform cardiopulmonary resuscitation. The breathing exercises and administration of ventilation is part of this maintenance of breathing. Checking and restoring as well as maintaining circulation involves ensuring that there is adequate cardiac output And this will entail making sure that the patient's heart is beating. Yeah, because as long as the heart is beating, blood is being circulated. Maintenance of circulation also involves, for example, thinking about bleeding. If someone is losing a lot of blood, then which is what we refer to as hemorrhage, it might lead to what we call hypovolemic shock. The body does not have enough blood circulating. So wound dressing, placing even a tourniquet, all these are measures to ensure that we restore and maintain circulation. Controlling bleeding again comes in here as that last portion when you think about circulation. And also treatment of shock, as I've mentioned. It could be management of the presenting type of shock. And we've said we've got several types of shock. It could be neurological based, which means the nervous system is involved. It could be due to septic shock, which means infection is involved. It could be due to hypovolemic shock, loss of significant amounts of blood, resulting in hypovolemia. So all these are key principles when you think about preservation of life, and brings in the three critical systems that are required for preservation of life. That is the pulmonary system, the cardiovascular system. Okay, these are very key, and to a large extent, the nervous system. Now let's look at prevention of deterioration of injury. How do we prevent that a particular patient or student who has been injured in a life-threatening situation, their injuries do not get worse? Okay, number one, never move a casualty, and a casualty from henceforth is anyone who has been injured. So never move a casualty unless it's absolutely necessary. Also ensure that when moving a casualty, be extremely careful. And this will bring into focus again if you're moving an unconscious or even someone who has been involved in a traumatic injury. Why one of the key areas that we look at is ensuring that we protect the head and the neck. And we'll look at this in our second session. Covering the wounds is important because it helps prevent complications associated with sepsis. Immobilization of fractures, again, to prevent other complications associated with discontinuation of a particular bone, for example, like compartment syndrome. Once you mobilize a fracture, you help to protect other structures around it, like other blood vessels and other even nerves, for example. Checking for other injuries, very important, because that which is not obvious is probably the most significant or life-threatening one. For example, someone has been involved in a road traffic accident. Most injuries, or some injuries here that occur, involve significant internal injuries. You could have a lacerated liver or kidney, for example, from a road traffic accident due to blunt force trauma. You will not be able to see this unless you check thoroughly for other injuries, other signs of buildup in fluid, for example, in the abdomen. If you suspect that someone has some sort of internal injury. How do we promote recovery and protection of the unconscious? One is treat the injuries in a correct order. Start with the most severe. The most serious is what we start with. Give comfort and protection to your casualty or the person who has been involved in a life-threatening situation, and then relieve pain. So start with the most significant injuries and then cascade downwards. Reassurance is very important as part of psychological support in a life-threatening situation. Because without reassurance, most people tend to act in hysteria. So being able to calm your casualty or calming down your student or your patient is critical towards recovery and even their own protection. Gentle handling is critical, and we'll look at this again, as I said, in the second phase, and positioning the casualty in a lateral position, which we refer to as the recovery position. The lateral position is where you lie the patient on their side, and with one arm under the head, protecting the head from the surface below, and the other hand lying next to the head. And we'll look at this again in our second session. General principles of first aid. What are these principles that we need to think about every time we are in a situation where we're first aid responders, or first aiders for this matter? One is always obtain qualified help as soon as possible. Call 911, call the nearest healthcare provider who is qualified in provision of first aid care. Next is avoid any unnecessary movements of the victim. Do not move a victim unless it's absolutely necessary. Reassuring the victim, again, as part of psychological support, is very important, while you ensure that you use a confident, a calm attitude, which is important because it helps to relieve a victim's anxiety. Avoid giving the victim anything to eat or drink, because you don't know what if they might have ingested a toxin, for example. Protection of the victim from cold and chilling is important, but avoid overheating. Okay, placing a blanket around your victim is good in a first aid situation, but placing 5 blankets, on the other hand, will be tantamount to overheating this patient or this casualty. When you think of ourselves as first aiders, think of the work that you're about to do. Work in a quick and organized and efficient, methodical manner. All these are important. Just like we think about our work, organization and efficiency are very important in first aid. Do not make a diagnosis or discuss the condition with observers at the scene. Right? As teachers, we don't want to discuss a student situation with other students or other teachers at the scene of the medical emergency. This is not right. Maintenance of confidentiality and protection of the casualties or the victim's privacy while providing treatment is a thought that should always be at the back of our heads. Okay, regardless of the gender, it could be a boy or a girl. Confidentiality and privacy are very important while providing treatment. Ensure that we take or make every attempt to avoid further injury to the casualty. Provide only the treatment that you have been trained or qualified to provide as first aiders. Don't take measures into your own hands, for example. If someone is bleeding profusely and you have never taken a suture or know what a suture is and decide that you're going to sew a person together, no, this you're not qualified for, because the management or the attempts to help this patient might end up further injuring the casualty. Examination of the patient should always be done gently. And please, ladies and gentlemen, let everything that you do have a reason. Let it be informed by a decision or having evidence for why you need to do what you need to do. Okay, let's not act out of panic or hysteria. Let's have a reason for anything that you do, which takes me back to the previous statements that I had mentioned. Being calm, composed are very important in provision of first aid care. Let's think about the golden rules of emergency care. what to do. What should we always do? One is obtain consent to try and help the patient whenever possible. Okay, especially in responsive clients, always ensure we get consent. Thinking of the worst is important because it helps us to take preventive and protective measures. Call and send for help, right? Always have the emergency number at hand. As teachers, as care providers to students and even to our fellow colleagues, being able to send for help is important. Identifying yourself to the victim is the number one rule in emergency or care provision. Please always ensure that they know who you are and how you're trying to help them. Provide comfort and emotional support involves reassurance, respect of the victim's modesty and physical privacy. Going back to what I had mentioned earlier on confidentiality and privacy. Caring for the most serious injuries first is in emergency care. This is very critical. Remember, we said we need to prioritize the injuries and the care that we provide. It brings into perspective a different notion of emergency care referred to as triage, and this is done by first aid or first responders, healthcare providers who respond to a medical emergency first. They always try and identify the most critical patients first and tend to them first. Okay? Those who have life-threatening situations classified in red, then they're the ones who can get care maybe after a short duration of time, about 30 minutes after the most critical have been catered to. And there are those categories of patients who can get to a hospital and get help from there. So this helps us to ensure that we try at least and save everyone. Assisting the victim with his or her prescribed medication as necessary is important because, for example, if your patient or your student is a diabetic, it's important to first identify whether or not they have any other chronic condition, for example, in this case, diabetes. Helping access their medication could be their insulin injection is very important because it will help you alleviate a complicated situation that would require significant medical attention. Keeping onlookers away from the injured person is important because ventilation, I know people love to crowd around an emergency situation, but keeping these people away is important to ensure that there is appropriate ventilation atmospherically for the injured person. And also, when you think about privacy and confidentiality, handle your victim to a minimum. Remember, we said have a reason for everything that you do. Loosen all tight clothing to assist with circulation. Splinter any injured parts in the position that you find them. Do not attempt to reset, for example, an injured, a fractured, or even dislocated limb. Do not attempt to reposition it in the appropriate position. Let that be the job of a trained health provider. Because sometimes, for example, if someone has a dislocated arm and you want to reposition it, you twist it in the wrong direction, you cause significant nerve injury, and that person can end up with partial or significant paralysis to that arm because you tried to reposition it, or even end up causing further damage, fracture, and even tearing blood vessels. Prevent chilling, but do not add excessive heat. We mentioned this, and stay with the injured person until a trained medical care provider or transportation, this being an ambulance, arrives. Now, what should we not do in an emergency situation or during provision of emergency care? Please, let's not try to arouse an unconscious victim. Let them remain as they are. Do not remove any penetrating objects. This is very important, ladies and gentlemen. If you find someone or a young student has fallen off from a tree when they were being adventurous, maybe trying to pick some fruits, and they have a penetrating injury to the abdomen because one of the, loose objects or sticks quickly punctures through the abdomen, do not try and remove this object. This object actually cannot be removed until we get to a health facility, one with an appropriate surgical team awaiting. Because usually when an object penetrates through the body, it causes damage to blood vessels. And removal of this object would cause significant bleeding, which might be life-threatening compared to if you left the object in place. Do not try to give anything by mouth to an unconscious person or anyone with serious injuries, and do not let the victim see his or her own injury. Also, do not leave the victim except if you need to get help. And always, let's try not to assume that the victim's rather obvious injuries are the only ones that they have. Remember, I said earlier that assessing for any other injuries is very important, because that which you obviously see, just because a person has a grazed knee, does not mean that that is, or those are the only injuries this person has. Do not deny a victim's physical or emotional coping limitations. For example, if someone needs to cry, let them cry. Reassurance is the key. Telling them not to cry is not what we're looking for, but reassuring them that you're trying to help and you're going to try and ensure that they get the best care possible is the goal here. Do not make unrealistic promises. You get to the scene of an accident and you tell someone that everything is going to be perfectly fine. Now we'll be lying. Because of course, if they have been injured, for example, if someone has, you get to the scene, and I'm terribly sorry to give this example, ladies and gentlemen, but if you get to the scene of a medical emergency and let's say someone's leg is lying a few meters away from where they are, and you say that they're going to be okay, let's not give unrealistic promises. If you said, for example, that you will try and ensure they get the best care possible, or you're trying to help them to the best of your ability, that is a promise, not an unrealistic one. Okay? Do not trust the judgment of a confused victim. If someone's orientation to place person and time, for example, is off, they do not know where they are, and you ask them how are they feeling, they tell you they are absolutely fine. This is a sign of someone who has a bit of compromised level of consciousness. So ensure that you carry out your own quick physical assessment to see if they have any other injuries. Do not require the victim to make a decision. All right, this is not the job of the first aider. The requirement of a victim or a patient or a casualty to make a decision requires a proper, thorough medical assessment, all right, and the presence of a trained healthcare provider. Do not move the victim unless the rescuer and casualty are at risk from further injuries, or if it's required for first aid to occur. And so remember, let's not move the victim unnecessarily here. Two situations might prone you or prompt a first aider to move the casualty. One is if the rescuer, this being ourselves here, and the casualty, our students, are at risk from further injury, or if where the patient is or where the casualty is, first aid cannot occur, then you're allowed to move But remember, ensure that you take measures to protect critical parts. For example, head and neck. They should always be stabilized before you move, and the spinal cord. Reassurance. Let's think about psychological support here. One of the key things, one of the most critical things that we can do to help a casualty is to reassure them. This keeps the casualty and yourself calm and will assist and ensures that as much medical treatment or medical help and attention can be provided is accessed. You may also need to reassure the relatives and bystanders who remember. So, for example, if a young student has been injured and their relatives or parents are around, this could be a significant hindrance to provision of emergency care, because they probably think they know best, and they think that in that moment, in that bit of psychological shock, that they want to be with their loved ones, but really they need to stand aside to allow you, the first aider, to provide emergency care. So after an incident or a casualty, take time to tell everyone involved how important their contribution was and if the outcome was successful or unsuccessful. It's important. Okay, did you manage to preserve life, prevent complications? This is critical to as part of reassurance. Stress. Now, stress. And in this case, I want us to think about stress when we think about ourselves. As a first aider, you may have an emotional reaction, especially if you had a significant connection with a casualty. Stress can appear either immediately after an incident or even months later. You are a first responder or a first aider when there was, for example, a road traffic accident that involved students. And ladies and gentlemen, these are scenarios in life we don't like to think about, but it's important for us to be prepared if these situations occur. So if you, for example, there was an accident that occurred that involved a few of the students that we have been with for quite some time, an emotional reaction involving these stressful bits can occur. And signs of stress that might present include frequent crying, difficulty in sleeping. Maybe we might even act out in anger. Apathy. Apathy is acting like we don't care, or nothing phases us. An increase in drinking or even drug use. Anxiety, very important. Anxiety and fear. Flashbacks that might cause even us to have, for example, moments of phasing out, delayed action in our day-to-day lives. Headaches, stomach problems, loss of appetite, depression, and even sadness. All this, if any of these signs of stress, or what we call PTS, post-traumatic stress, occur, get professional help if it does not resolve. And it's important to sit back after an emergency situation, talk about it with a few people. Talk about what you saw, what happened. It helps us to kick in our coping mechanisms, because failure of our coping mechanisms results in post-traumatic stress. So if an emergency situation occurs, and I'm talking this to even the managers who are in this session, that, look, it's important to let our people take time off. Take time off, relax, find something that takes their mind off things to try and relax and mitigate against a stressful situation. Hence brings me to this. After an incident, an emergency situation, a life-threatening situation, and please note that your involvement does not end when the casualty or when our student leaves or gets better or goes to the hospital. Please take some time after us to take a breath, take a break, talk about the incident with others, relax. Okay, clean up the scene and equipment. And importantly, please let's not forget to ensure that or first aid kits are restocked. Whether it be it in the school bus, be it in the school itself, be it in a classroom, or even the staff room. Ensure that your first aid kit is appropriately stocked. And you can have monthly checks and inspections to ensure that this particular area is well stocked. So a quick review of what happens in an emergency situation. Remember, we said safety first. Your own personal safety comes first, so safety assessment. Then comes the response, calling for help or shouting for help. Support the head and neck if you need to move the patients. Then if a patient's key critical systems required for survival are compromised, then ABC or cardiopulmonary resuscitation kicks in. That means ensuring that you have a patent and well-maintained airway, breathing and ventilation are taking place, circulation, okay, by controlling bleeding and ensuring that the heart is beating. Then do a quick secondary survey. Look at the patient again. Look for other signs and symptoms of other injuries that might not be very obvious. Do a quick history, not a very thorough history, quick history to find out what happened, where were they when something happened, all right? And then from here, ensure that there's appropriate and authorized transportation to a hospital involving an ambulance with a paramedic team if available. So for the next few minutes, before we take a break, I want us to look at what all these stages involve, from safety assessment all the way to transport in the hospital. Safety assessment is ensuring that the scene is safe right before you enter it. If not, please remember, like I said before, you are of absolutely zero help to anyone if you're injured or hurt. If your casualty or your student is in danger, move him carefully without putting yourself in danger. Again, taking care of the head and the neck. Bystanders can be very important. They can help protect the scene and also can help you as a first aider to call for help. Response. How do you respond? Check to see if the casualty is responsive. If they can be able to respond verbally and in action and they are conscious, ask the casualty what happened, where it hurts the most. Right? If they're unconscious and unresponsive, assess the airway, breathing, circulation, and signs of life, the ABCs. And we'll look at this when we look at basic life support. Be prepared to perform life-saving techniques in the name of resuscitation. Controlling bleeding. Try as much as you can to stop it quickly by putting a thick dressing over the wounds and applying firm pressure to it. If the wound is on the limbs, elevate the limbs to ensure blood flow is towards the heart and keep the patient calm and still. Very important as part of reassurance. Let's try and use gloves as much as we can and try not to touch any blood or any fluids or any secretions from a patient, especially if you're querying that it might involve some sort of infection or sepsis. Support of the head and neck is important in case of an accident that involves a fall, a car accident, or even speed or velocity related injuries. Ensure that your patient or casualty remains still. Support the head and neck by placing your hands over the ears. Okay, so on the sides, on the temporal bits of the head to hold the head still. If there's no obvious neck damage, please always ensure that you assume the worst, especially in unconscious patients. Always assume the very worst. A secondary survey occurs after you've ensured that airway, breathing, and circulation are intact, and any major hemorrhage or bleeding has been stopped. It involves checking the rest of the casualty or the patient, assessing them quickly from head to toe for any signs of injury. I said head to toe, so start from the head and move downwards to the feet. Use your hands to ensure that you compare both sides of the body at any particular time. All right? So this ensures that you move systematically, looking at both sides of the body in a symmetrical manner. History involves asking the casualty what happened. Okay. Ensure that you get a thorough and ample history. Ask them, do they have any allergies, any medications that they might be on, their past medical history, even the last meal that they had, and what were the events that occurred preceding or that occurred leading to the accident. So thorough history helps us to get information that might be critical to further management of the casualty down the road. So ladies and gentlemen, looking at my time, I would like to pause there and just to get a feel of where we'll be going to next. There's a bit about transportation. So after that, I think we shall look at what are the contents of a first aid kit, a home first aid kit, as we move forward and look at other critical components of basic life support. If I'm allowed, Dr. Njoroge, can I pause there?
Thank you. Very good exposition. We have really benefited, all of us, including the staff who are in. This is very good for the teachers. We understand the environment that we have. We want to take this opportunity to thank you for that exposition. And it's now 1 p.m. We allow you to have a health break. We are with the good doctor with us. He will come again in the afternoon, complete the content. I would assure you, Mr. Mwangi, that the questions are here, they're overwhelming. We will discuss and respond to them later in the plenary. There are many questions that the teachers want to understand. Like, how can one help someone who has been bitten by a snake? There are many questions. How do I protect a child from domestic violence? I know some are Dr. Mirimowe, some belong to you. So we want to thank you, Mr. Mwangi, sincerely for the exposition. Maybe we can have lunch, and then we come back at exactly 2 p.m. You get a new link. So teachers, ladies and gentlemen, we want to thank you sincerely for choosing Mount Kenya University as service provider of choice for the TPD program. And 2, for joining today's webinar. And I think now we are running, and I appreciate the comments which are coming through. Kindly don't worry about the assignments. We will give you 1.5 months to go through every activity and respond. So the concern now is get the content first, so that we are able to respond and get the content for effective teaching and for improving the learning outcomes. And eventually our Kenyan child has learned, and we are all a happy nation. So thank you so much once again, Mr. Mwangi. Let's meet in the afternoon. Thank you.